Hi, I'm Ellis with Level Up RN. This is my quick explainer video of the Next Generation NCLEX, or the NGN. If you want a longer video where I do like a deep dive into the item types, into scoring, into like why are we doing this, then I do have a longer video on our channel about that. But for those of you that just want the what, why, and when, there are new items on the NGN. The NGN is just the NCLEX with different item types added. And I want to be very clear about that. The entire exam is not changing. I think that's the most common misconception I've heard. Only about 25% of the exam is going to be the new item types. The rest of it will kind of just be what it used to be, the multiple choice type items. So only 25% are the new item types. And these new item types were added to assess clinical judgment. Why? The NCSBN, the National Council of State Boards of Nursing, researches current practice, right? They talk to facilities and managers and nurses, and they determine what is it that makes a new nurse a good new nurse, right? A competent, a safe practicing, leading to safe patient outcomes type of nurse. And they've determined that new nurses are really struggling with clinical decision making. So they adapted the test plan of the NCLEX to include items that assess for clinical judgment to make sure that nurses that want to be nurses or people who want to be nurses are able to demonstrate that they have clinical judgment skills. And when? April 1st, 2023. So next April will be the rollout of the NGN. So if you're going to be taking your NCLEX around or after that time, then you'll be taking the new version of it. So best of luck to you. If you have any questions, let me know or check out my longer video. Thanks.
I invite you to subscribe to our channel and share a link with your classmates and friends in nursing school. If you found value in this video, be sure to hit the like button and leave us a comment and let us know what you found particularly helpful.